Hello, everyone. Welcome again to another MAP chat. And we're here to talk about advocacy. And I wrote about it last month in our blog. And I mentioned a organization called Washington Autism Alliance and the CEO and president founder, Arzu Forough. I'm absolutely thrilled to be introducing her to our audience. So Arzu, advocacy is you got it down. So we're excited to have you talk about everything that you're doing, and especially Washington Autism Alliance. So thank you for being here.
Thank you for the opportunity to have this conversation. It's always great to speak to other fellow journeymen along the way. We're all on this same journey at one place or another. So thank you for having me.
Oh, absolutely. It's our pleasure. And, I just want you to share with everyone, about yourself and what Washington Autism Alliance, just let us know more about what you're doing.
Advocacy organization that provides case management, family navigation for individuals and families on the autism spectrum, as well as other developmental disabilities. And we found early on that access to healthcare and access to effective education programs is really paramount for a person to thrive in their own community. And so our team, although very small, is comprised of mighty and tenacious advocates that support our families every day. We also have some special events throughout the year. One of those I'm especially proud of is a training webinar for families on how to use the building blocks of education laws to make sure that students have access to effective education programs. And that's called Blueprints to Special Education. That happens every spring and every fall. We also have some social and support groups for individuals and families. We think that it's not only important for us to help our loved ones learn to be out in the world, but it's also important to teach the world how to support our loved ones. And so that's the focus of supporting Friendship Matters, supporting youth. And just a little more about some of our services. As I mentioned before, we offer case management and family navigation. That's one-on-one phone support, chat support, and online. We're very fortunate that we were really used to this digital connection to others before the pandemic. It was really fairly easy for us to do this during the pandemic. The case management is paired with legal services. And so if a family calls in and they say, I've been handed this 40-page document, my person, regardless of where their age is, whether it's a toddler or a teenager who's just been diagnosed with autism, is given this complex packet and we don't know where to start. And so that's the start of our conversation with them. Where are you in your journey? How is your individual and family impacted? What can we do to make sure that you're getting everything that you need to make your life easier?
Well, and they probably don't know where to even go with that. So
you're absolutely right. You're absolutely right. And some of us are better prepared than others, and some of us, like me, come into this journey without any information.
Right.
So depends. And that's where our legal services come in. We provide IEP coaching, we provide representation in order to improve access to care. And just a snapshot of what are some of the issues that bring people to us. As you can see, emotional and behavioral support is probably the top, not probably, but based on our data, is what we get called for the most. People know us from a lot of the landmark cases in the state as well as the nation, in how we've clarified laws that provide some services for individuals with intellectual and developmental disabilities, including autism. One of those is DF versus Washington State Healthcare Authority. This was our children were the named plaintiffs for this, and it established coverage of screening, diagnosis, and behavior therapy, including applied behavior analysis for all public employees. And if people are wondering how many children are accessing this, so over 16,800 dependents of public employees are eligible for this every year. And then we realized, well, what about all the children and all the individuals who are dependent on state insurance and are Medicaid eligible? Washington is one of those states that covers all of its children. It's really remarkable, but we have over 52,000 children now that rely on this benefit. And before 2010, even screening was not covered for these subset of individuals. And we reached a settlement in 2012 that now requires the state of Washington to cover screening, diagnosis, as well as evidence-based therapies. Here in the conversation, I spoke about best practice guidelines. Marikay, you were kind to mention this. Here's a link to it, and I'm happy to provide a hyperlink to this. It provides conversation points during an IEP of what are all of the different areas that should be looked at and decided whether this is an area that needs an IEP goal or needs to be addressed in an IEP. And I'm not suggesting that every single one of these will go into every IEP, but these are all talking points. They should be considered during an IEP. And so this is our best practice guidelines that passed in the 2008 legislative session.
Yeah, this is really wonderful, I think, because going into those meetings, as you said before and alluded to before, I mean, you're getting this tremendous document, and to discern through that as a parent, like you or I or other parents out there. I mean, we're not attorneys, we're not educators. So, I think having some sort of a guideline that gives at least some parameters for helping to navigate through an IEP is just even at a top level, right? Is
Absolutely.
a very powerful tool.
Absolutely. Can I ask for teacher training? Can I ask for the staff to be trained? Can I ask for my son or daughter not to have minimum unstructured time at school? This document is intended to have all of these as talking points during an IEP.
And are more and more people coming to you with advocacy type topics like this, examples of areas where that you need to intervene?
I love that question. I think that's such a great question. Sometimes when someone comes to us, they don't necessarily have a clear-cut case, as is the case of seclusion and restraint. They might be presenting with an obstacle that is definitely not great education, but it's also not something that has a legal solution. So in those cases, we help coach them through how they can be more effective advocates for their students, and how sometimes they're not using the right terminology, and what their desired outcomes are really attainable through just some coaching. We know that there are some families whose children have really exceptional needs that are not being met in Washington State. The parents in schools might decide to send some of these students to therapeutic boarding schools. Some of these students, we've heard a lot in the media in the last few years, are boarded in emergency rooms for long visits. And we just think that Washington State can do better. And we're hoping to establish enhanced behavior support homes for these individuals who experience significant challenging behaviors, so that they are able to live in the community and get the services that they need to thrive in their own communities. it is just not humane to have a person with intellectual and developmental disabilities spend 200 days in an emergency room, or not in an emergency room, but in a hospital room when there's no medical need, right? And it's also really difficult to decide to send your 11-year-old across the nation. And so we hope that by bringing these enhanced behavior support homes to Washington State, we're able to support our individuals with intellectual and developmental disabilities here in our own communities.
So there's nothing here existing, correct?
We presently don't have this. Yeah.
So how long will it take, do you believe, to advocate for this?
That's such a great question. The legislative process takes a long time. First, you have to establish the need, you have to find a champion, you have to really speak to all of the decision makers and help them understand that there's not only the financial toll to the state, which sometimes seems to be the only thing that people are looking at, but also the toll on the individual and their families is so great that we just can't go without a program like this. And so that sometimes that takes years.
Yeah. Well, great work as all of it is.
Thank you. I do want to mention that there is a program underway right now at WAL where we're providing pro bono legal services for special education for anyone who's below 200% federal poverty limits. They will get access to free special education coaching and representation. And so if there are any families out there whose students are struggling and they meet eligibility for this program, we started this as of the beginning of the year. And feel free to go through our intake line to access these services. And we hope to offer the same type of programming for students who are eligible for DDA, Developmental Disabilities Administration, hopefully as of July of this year.
Wonderful. The beginning stages of your presentation, that a lot of people would know you from your cases. And I really would say, I don't know that people do. I think a lot of people have just taken for granted what is here today because of you. So, I mean, that's one of the things that I want to champion within our resources and our MAP website, are people like you that are out there doing the work and the grassroots work to rise up these issues within our legislation and just even within our schools, just so people have a better understanding for what our kids go through.
Thank you.
And all of your journey with this, I'm just curious, what drove you? What was your passion for it?
My children.
Yeah.
I seeing firsthand how much a child struggles to make sense of the world around them and continues to struggle as they're growing up is really what motivates me to want to prepare Washington more every day. That's really what motivates me.
That's wonderful. So
there are in Washington State less than 20 attorneys that specialize in special education who represent families and students in disputes with school districts. And we're very, very fortunate that 4 of them are going to be presenting at our next Blueprints to Special Education. They will take topics on how evaluations work to build a program, how to write effective goals, how to track and document progress, what to do if there's disagreements. What do recovery services mean during the pandemic, and offered every year in spring and fall in time for IEP season?
Yeah, we'll definitely be posting, all of your information within
Thank you.
this month and going forward, so people can reach you, know you, get access to you very quickly. And when people do contact you, I know you're going to go through an intake. Is there anything that they should be specifically asking for? Is any advice that you want to give anybody?
There's usually a reason why we start looking around, right? There's not a need that's being met. Staff are trained to ask questions to get a really good understanding of what is your family's experience. What is it that is bringing you? What are your goals, right? We might think that this thing is as great as apple pie, but you might not necessarily need that in your family. And so we want to make sure that we're meeting your goals. And the more information you can share with us, the easier it is for us to work with you to find a solution for you.
That's wonderful.
Thank you.
Well, Arzu, so great to have you with us. And I'm sure our MAP audience is going to be contacting you and learning more from what you offer. And it's just fantastic work that you've done. And I know you're going to be continuing to do so much more. So thank you.
Thank you for the opportunity. And thank you for making it so easy to be here today.
Wonderful. And your PowerPoint was fantastic. So thanks.
Oh, thanks. Thank you very much.
Thanks.
Bye-bye.